Welcome back to ARC Salt Lake, where we cover authentic, relevant, and community stories.
Well, we have a guest here today. We're talking about Planned Parenthood. There are 6 Planned Parenthood centers in the state of Utah now. 2 clinics were just shut down last month, the one in St. George and the one in Logan. Now, the federal government actually froze $2.8 million in funding to those clinics.
More clinics could potentially close under the proposed Big Beautiful Bill if it's passed by Congress. Joining us in studio now is Shireen Ghorbani, interim president of Planned Parenthood of Utah, to discuss potential changes and healthcare options. And thank you so much for being here this morning. We appreciate it. You know, talk about the services that Planned Parenthood of Utah provides.
Yeah, so we are a family planning center. So the majority of what we do is help people get access to contraception, to birth control, STI testing and treatment, making sure that people can get cancer screenings when they need them. The vast majority of the work that we do really falls into that category. We are also still able to provide abortions up to 18 weeks in Utah.
Okay, and healthcare services for women, and mostly women in need.
Yeah, that's right. So the vast majority of our patients are uninsured or underinsured. So these are folks that, for a variety of reasons, are usually they're young. So individuals that come and see us are young, and we know that young people are often in jobs that may not offer health insurance, or are, you know, between maybe different work, or they have a number of different jobs. Unfortunately, that means that a number of those people live without regular access to health insurance. While we accept health insurance, we also really work very hard to make sure that individuals all across the state have access to low-cost, high-quality care to make sure they can get birth control, make sure that they can control and plan their families as they need to.
So how could these federal cuts further, impact centers in Utah and the people that use them?
Yeah.
Could we lose services?
Yeah, so we've already lost services. And what I think is really important for Utahns to understand is that the administration's decision to withhold Title X funding. Title X is the only domestically funded family planning program in this entire country. So again, that's covering birth control, contraception, right? Access to STI testing and treatment, making sure that you can get a basic health screening. We're also able to screen for cervical cancer, breast cancer, right? So those kind of core things that really help establish a person's health, right? Their well-being. That's funded through Title X. Right now, Utah is one of 7 states where that funding has been completely withheld, and that really means the defunding of Utahns. 26,000 Utahns sought care, received low or no cost care from Planned Parenthood through Title X last year. That is no longer happening, and because of that, we were forced to close St. George and Logan clinics. So unfortunately, what this means is there are fewer options for people to control their, sexual and reproductive lives, to plan their families. And what that means is that we see that people get into all sorts of difficult situations where they're trying to figure out if they can go to a community health center or find care in different ways, or frankly defer care.
Oh, and sometimes if these things are helped early, then if they're not helped early, then they'll cost more later down the road.
This is very true. So when we think about things like untreated STIs, right? Most sexually transmitted infections are treatable. They are curable, right? But left untreated can result in really devastating impacts, including infertility, right? So if they know that down the road they want to have that family, we want to make sure that they are getting tested and treated, that they're healthy, that they're, really entering into a world of, I guess I would just say, without going too far down the road. It's difficult for Utahns to get high quality education, sex education, to know what's going on with their bodies. Planned Parenthood is a place where people have always been able to come to understand their sexual and reproductive lives, and we're proud to continue to do that through telehealth services and through our 6 remaining clinics.
Well, it looks like this bill will pass. What are the options for health care for women who usually have your help?
Yeah, so, well, it's a little TBD, right? Because right now what we're seeing is the Senate parliamentarian is going through and looking at different components of the bill and deciding, is this within the purview of a budget or not? Okay. So there are changes happening daily. So I'll just say right now, the effort is to really defund Planned Parenthoods across this country, and that means that they would no longer be able to accept Medicaid patients. In Utah, we haven't had the biggest uptake in Medicaid, right? So we don't have as big of an impact here in Utah as we will in other places, but I just need to put a number on it. We're talking about 65,000 people in our state potentially up to 115,000 looking at changes that are being made around the ACA that are poised to lose health care. That is what we are facing as Utahns.
And so, for people, just to be clear, for people who want to seek your services where they can, where can they go? How can they access it?
Yeah, sure. So ppau.org is how people would schedule an appointment with us. We have clinics in Orem and in Ogden, and then we have 4 in the Valley, 2 in Salt Lake, South Jordan, and West Valley City. But a number of services that we provide, for example, access to contraception, to birth control, can be done virtually. So we're also able to provide that care. But I think it's really important for people to understand what is happening right now with the federal administration is a dismantling of our public health infrastructure. It's not just us. County health departments are losing funding. Hospitals will lose funding. If this Medicaid provision goes through, rural hospitals will close.
Well, and you closed in St. George and in Logan. What are those people doing for care now?
For care, yeah. So some of those communities, in particular St. George, has a little bit more healthcare infrastructure. Community health centers are there. Intermountain has a large presence there. But in Logan, it is a little bit more difficult. We're grateful to be able to still serve people through telehealth. We also know that people will have to travel to Ogden to receive our care.
All right. Shireen Ghorbani, the interim president of Planned Parenthood of Utah. Thanks for joining us.
Yeah, thank you for having me.
Good luck.
Yeah, thanks.
We really appreciate you taking the time to talk to us this morning. Thank you.